So just
Okay,
kidding.
you all
Yeah.
know the plug. How many maxillofacial surgeons do you see in Rwanda?
What doesn't he like about maxillofacial surgery?
If I were that patient, how would I want my doctor to be?
Young doctor now,
Right.
starting to think of opening a clinic one day.
Who to talk to? Mwah. So just
Okay,
kidding.
you all know the plug.
Just
Hi, welcome back to Scraps and Stories, a podcast that brings you stories from the world of medicine and beyond. In this episode, we discuss with Dr. Kulkarni, who is the lead program director of the Residency in Oral Maxillofacial Surgery in Rwanda, and also the owner of Kivu Specialist Clinic. In this episode, he takes us through his journey as a global surgeon, all the way from India to Tanzania and finally to Rwanda. Without taking so much of your time, let's get you scrapped in and right into the episode.
So after moving to Rwanda, you've
Yeah.
held very many different positions in
Right.
in the medical system here.
Right.
And like you said, at the time, I can imagine there were maybe one or two maxillofacial surgeons in
Right.
Rwanda. So when you came here, was it to practice or more of like teaching and like teaching that the generation of
Right. So
maxillofacial surgeons?
the idea of me moving here was twofold.
Yes.
One was to kind of lay the foundation for my colleague to kind of eventually take over where I leave that whole project, and also to look at possibility of setting up some kind of a training. So as you know, surgical training is basically care delivery,
Yes.
and you're educating somebody on the job.
Yes.
Right? That's what medical education is all about.
Right.
So that was how we identified that position. That was how we kind of looked at it, and we started working towards it. And it took almost 8 years to get to the point with the current leadership in the health sector, which has put in some amazing efforts towards bringing in homegrown talent in
Yes.
surgical specialty and medical specialties as such. And that's where a training program in maxillofacial surgery was conceived, and I was chosen to be a part of that whole effort. So currently I'm like heading the program, like program director for that residency.
Right.
It took us 2 years to get the curriculum together. I wouldn't say we got the curriculum right.
Yes.
I think we've got the curriculum, we've put it together as per what it is meant to be, what we think is a good starting point.
Yes.
And like we say that a curriculum or a training program or like a manual for a training program is a work in progress. You're
Yeah.
constantly working on it and making it better as you go. So this year we are going to start the residency program. So you can say that I've reached a landmark
Yes.
on this journey. So that's quite exciting, and
That's very
it's
exciting.
great. Yeah.
So we're
Yeah.
going to have more maxillofacial surgeons in Rwanda. There's a
Yes,
bright
that's
future
the
for
plan.
that.
Oh, very
path.
much, very much. I mean, look, in entire East Africa, each Uganda has a training program, Kenya has a training program, Kenya, I think, has more than one training program for maxillofacial surgery. Dar es Salaam Muhimbili Hospital has a program. These are all like established old universities like Mulago Hospital and Kenyatta Hospital and the Muhimbili Hospital. These are like few decade old program.
Okay.
So now we are kind of catching up with the rest of the region.
Yes.
So I mean I don't know the exact number, but if we were to say that the
How many?
overall
About 5 maybe in Rwanda?
5, yeah.
Yes.
Now we are 6 maxillofacial surgeons,
Yes.
out of which we have 2 Rwandese and 4 expatriates.
Okay.
And the idea of this program is that this proportion has to be reversed. I see myself in the next 5 to 7 years as a person who my colleagues may or may not need to consult
Yeah.
for anything.
Right. That's
That is where I would like to, I mean, that is where I'm working towards. That my colleagues in this whole setup, they would be heading this thing, they would be running this thing, and if I can complement, if I can help, great.
Yes.
So
Right.
that's where we are heading.
That's very exciting. You
Yeah.
talked about the residency in Rwanda now, and at the beginning of the podcast, you talked about how it's different in different countries.
Right.
What does it look like in Rwanda? Do you have to go through medical school first, and then
Right.
dentistry, and then specialty? What does that look
Right.
like?
So currently
Rwanda?
we have aligned ourselves with the region and have a dental graduate entering the program. But we are working towards having a medical graduate entering the program and all of this thing. There are a lot of technical, things that we need to put in place.
Yes.
And as you know, that we are part of the EAC, so the regional block has its own standard mechanism. So we need to liaise with them. And then there is a bigger mechanism which is on the continental level. And so we have to look at standardization, recognition, and all of that. So there is a lot of, I mean, it's much more to it than what meets your eye. So getting this kind of a residency on track
Yes.
has a lot of background work. So we have done one bit of it.
Yes.
We are working on the second bit of it.
Okay.
And with the right kind of support and right kind of effort, we will get the medical graduates coming in as well. Eh,
Why was
and-
it much easier? Maybe not easier, but why is it that dentistry is what came first? Is it much
I
easier
mean, it's traditionally evolved out of dentistry,
Okay.
right? It is,
Right.
see, out of the medical graduates getting into surgery and plastic surgery, they do practice some parts of maxillofacial surgery, but not the whole spectrum of it.
Yes. Yes.
So that's what we are trying to kind of establish. Because look, we can't be talking about training and capacity building looking at how it was done 30 years back. We need to be looking at what
Now.
is the requirement now
Yes.
and what it is going to be in the next 30 years.
Right.
Because any graduate who is going to pass out, who is going to complete their training, is going to be around the age of 30,
Yes.
right?
Yes.
30, early 30s. So you're going to have like 30 to 40 years of active medical service that the person is capable of delivering,
Yes.
right? That is what you look at.
Yeah.
So you can't be basing the person's profile on what it was 30 years back. It needs to be what it is going to be ahead of us.
Yes.
So we need to prepare ourselves for that.
Yes.
So that's the whole idea.
I see.
Yeah.
Yeah, makes
Yeah.
sense. I'm interested in one of the you've done many research publications. I'm interested in one specific research you did in Rwanda that talks about the delay in providing
Right.
delay in maxillofacial surgery.
Delay in
in
access
Rwanda.
to treatment for maxillofacial trauma.
Right.
Right.
And I was pretty surprised to see that most of the delay comes from having few doctors,
Right.
so delaying the surgery,
Right.
and not the patient getting to the hospital.
Right.
So, first of all, what inspired that research?
So it's like for any such research or any such problem, we need to establish that problem through a very unbiased
Yes.
and an educated, analytical kind of a manner, right?
Yes.
A research program. So I was supervising and guiding one of the ENT residents who was very much interested in this, and we looked at what needs to happen. Now, going to a hospital management, like top management, and you saying that, oh, I need this,
Yes.
where is that person going to go? The person is going to go to his boss or her boss, right? So they sit and discuss this thing. So we need to give a proper, you know, you can say ammunition for that whole thing to be presented, for it to be discussed, and where do we start? What is the basis of it? Right? So
Yes.
this is like you have a problem statement
Yes.
that you have, you've identified, and now you are getting all the evidence for this. So this is a part of that evidence.
Right.
Not having enough doctors, yes, I mean, we don't fit the WHO recommendation and all of this thing, but very few countries do. But there is great effort being made towards changing that proportion in Rwanda,
Okay.
right? So
Right.
that's where the whole residency program comes in. So these kind of, you can say, pieces of evidence add up to kind of justifying something that we are putting in place.
Yes.
And then that helps us connecting with our international partners, different universities, different sources of funding, all of that thing. It's, I mean, there is nothing that is happening in isolation. You always have connections happening all around.
I see.
So yeah.
So I can imagine one of the things that also inspired it is because maybe because there's very few maxillofacial surgeons in Rwanda, you also have very high demand.
Yeah.
What kind of, like, what's the biggest challenge of having very few, both on your side as a doctor and also the effects on the patients from your practice? What are the biggest challenges that you've seen or effects it has had on
Right.
patients?
So the biggest challenge that we see is delay in access to safe surgery. Look, there is access to surgery and there is access to safe surgery.
All right.
So when you talk about safe surgery, you're talking about safe anesthesia, safe post-operative management of the patient, number of caregivers, the right kind of setting. Now, maxillofacial surgery, when we are talking about a major intervention, the first thing that comes to your mind is airway,
Yes.
right? That's
Yes.
part of your BLS, airway, breathing, circulation. So that is step number one,
Yes.
right? So you need to keep the patient safe. You might do a beautiful reconstruction, but if the patient is not in safe post-operative environment, you might lose the patient, right?
Yeah.
So access to safe surgery, which is one of the things, having very few specialists who can actually tackle and give a comprehensive solution to that problem, that leads to delayed intervention. Delayed intervention leads to higher rates of complication.
Yes.
And I mean, we rarely talk about the psychological effect of all of that on the patient,
Yes.
right? So it's quite significant that delay in surgery has so many implications. I mean, if a tumor was identified when it was small, the
Yes.
surgery would be small, reconstruction would be easier, the complications would be less,
Or even
and the
trauma patients.
right, even
especially.
trauma. So
Yeah.
if you fix a trauma patient in time, the hospital stay is less, the intensity of intervention is less,
Yes.
right? So if a trauma patient has a malunited fracture, or unfortunately in oral cavity there is a high rate of infection of those fractures, so that leads to osteomyelitis, that leads to so much of ripple effect.
Yes.
So as you must be aware that WHO has called trauma as a one of the NCDs, right?
Yes.
So this is what it means. So the overall impact eventually kind of, it's a reverse pyramid, and it trickles down to your health economics. For a system like the Mitwell CBHI system that we are following,
Yes.
which gives a 90% subsidy to the eligible citizens,
Yes.
you can imagine it, end of the day it is coming out of the government coffers. So it makes all the sense to invest in training, invest in infrastructure, and getting the right people involved to get the number of surgeons to increase, so a person can get access to these surgeries in provincial hospitals, and they don't have to come to Kigali for that matter.
Right. So
So-
tell me the future of
Yeah.
that. Like an estimation. say in 2 years to come, how many not 2 years, maybe in 5 years to
5
come.
years, right.
Yes, how many maxillofacial surgeons do you see in Rwanda?
Right. So at this point,
According
we are 6 of us,
Yes.
right? And 4 other candidates are undergoing the training process in the region.
Okay.
So that is going to be 10, and we intend to train our own residents in University of Rwanda. So it's going to be a good number of 20 odd surgeons in the next 5 years in training and in practice.
Oh, that's really
So that particular study will have a follow-up study at one point,
Okay.
which is going to highlight the impact of this kind of measures put in place by the Ministry of Health and the government of Rwanda, and the impact it has. Like, this is tangible, this is palpable. You can feel it. It's there.
Yes.
It's not just hearsay.
Yes, I was
Right,
very
yeah.
interested in that study
Yeah.
because you also see it's like if you spend a few days at the emergency ward, you see a lot of trauma patients
Right,
that have like injuries on their face.
right.
So I always used to think maybe it's the delay in coming to the hospital or the delay in the trying to find the doctor, trying to put the patient in the hospital. So it was pretty interesting to see that a lot of delay is in the surgery, waiting for the surgery itself,
Right.
or the surgical rooms as well.
Right. See, it's multifactorial. It's not just one thing.
Yeah.
Because, say for example, if you had such a bad trauma where you have facial fractures, you are very likely to have other injuries.
Yes.
Right. Okay. So, like a bike accident, typical bike accident, you fall down, you fall off your bike and on your face.
Yes.
So yes, you do have fractures on your face, but you would get blunt abdominal trauma. You can get lung contusion,
Yeah.
which is not pretty much safe for the person to undergo surgery in those situations till that is not sorted out. So
Right.
there are multiple other things. So it's not just one particular aspect of it.
Yeah. But
Under ideal circumstances, which we have done on multiple times, that within 48 to 72 hours the person gets definitive care.
yes.
Right. It happens. Unfortunately, there are times when it doesn't happen, and that is what needs to change.
Yes.
Good things need to get better, and bad things need to stop happening.
Right.
That's the whole idea. Yeah.
That's very interesting,
Yeah.
and I'm looking forward to see more specialists or even young doctors getting inspired to get into the field because it's much needed in Rwanda.
We share the dream.
Yes.
We share the dream. Yeah.
But as we talked about earlier, you hold so many positions and you have involved yourself in different career paths. You're also an entrepreneur because you have your own clinic,
Right.
which is Kivu Specialist
Right.
Clinic.
Right.
How did you get into that? What inspired you to start your own clinic in Rwanda?
Right.
And what was that process like? Like from the management thinking about the project itself. For someone who wants to start their own practice in the future, what kind of advice would you give that
Right.
person?
The idea behind this clinic was to kind of provide a solution for a particular missing area of expertise in the private healthcare spectrum. The original project was to evolve into a family practice, kind of a multi-speciality family practice kind of a clinic. That project got, should I say, T-boned, hijacked all the way when the residency training program came
Right.
up. And then, I mean, it's a simple thing of priorities. Like,
Yes.
one project is more important, has a bigger impact, and is more essential. So then the other project kind of went on a back burner kind
Backbench,
of
yeah.
thing. Yeah. So that was the idea. But when you talk about essential healthcare, public healthcare system, and move across to private healthcare system,
Yes.
there is one component that we always forget. I was talking about the psychological impact of delayed healthcare and all of this thing.
Right.
We don't look at healthcare as an experience.
Mm-hmm.
We look at something as what you need in that particular moment.
Mm-hmm.
But that is not necessarily true all the time,
Right.
right?
Mm-hmm.
So the idea of that clinic was to create a better healthcare experience than something that I experienced myself with my time in Kigali.
Mm-hmm.
I grew up in a medical environment, so I saw all of this thing since my childhood.
Mm-hmm.
And a lot of my friends are either owning practices or heading institutes or are, you know, chief consultants in corporate hospitals like Apollo Hospital in India. And that was the whole idea of getting somewhere in that direction.
Right.
So that's where we started, and I mean that's where we met,
Mm-hmm.
isn't it? Like when you came to
Right.
the clinic
Yes.
to accompany your friend for her treatment, and that that is the kind of experience that I would like to go through,
Mm-hmm.
right?
Yes.
So I mean, I've always looked at it from this perspective that even if I'm sitting there as a consultant surgeon, or if I'm called in the trauma room or in any caregiving capacity,
Mm-hmm.
how would that patient want me to be? If I were that patient, how would I want my doctor to be?
Mm-hmm.
That's my benchmark.
Right. Mm-hmm.
And that is where that whole idea that the clinic has to have a particular ambience and particular, it needs to look a particular way, it needs to feel a particular way.
Yes.
So that's where the whole thing came in.
Yeah.
So now it's far way away from the original dream,
Yeah.
but then it's there somewhere.
Yeah.
Yeah.
So at the clinic, you see so many different kind of patients, especially for Rwandan people or anyone in the region that is listening to this podcast. What kind of patients are usually seek your help? Like usually come to the
Right.
clinic. What kind of patients do you see on a daily?
It's a outpatient facility, right? It's not a hospital based practice. It's an
Right.
outpatient facility. So something which is straightforward, simple, oral surgery, dental implants, and something that doesn't need general anesthesia for management of that condition, that kind of thing. I have colleagues working there who do general dentistry. We have somebody doing orthodontics. So this is like a segment of healthcare that was kind of essential in the big spectrum of services.
Right.
Look, the things that I do, the kind of patients that I receive at the hospital, is a complete different end of maxillofacial surgery.
Right.
What I do at the clinic is possibly the most basic, the most fundamental stuff
Yes.
of maxillofacial surgery.
Right.
And then it gets scaled up to right up to, skull-based tumors and fractures involving the orbit and cancers of the mouth and all of that thing. So it's like two different ends of it.
Right.
Yeah.
I'm curious to know, but because creating or starting a whole clinic, that's somehow it comes with a lot of management. It comes, yes, there's a career of being a doctor, but there's also that aspect of being an entrepreneur, knowing how to manage the clinic. For someone thinking, like a lot of doctors fear that because they feel like it's a lot of work, or it's how am I going to manage this, doing the work and managing the clinic itself. How would you advise someone thinking of starting their own practice in the future, a young doctor now,
Right.
starting to think of opening a clinic one day? What are some of the things that they should be aware of, some of the things that they
Right.
should keep not?
So one of the biggest things that has been traditionally missing in medical education is entrepreneurship and financial, you can say, awareness,
Right.
right? So, what does it take to provide standardized healthcare? And what is the cost involved? And does that reflect on the receivables? And how do you find that balance?
Right.
You might think that your time and your skill is worth X amount of dollars. The patient doesn't necessarily look at it that way,
Yes.
right?
Right.
So finding that balance, and then if you want to scale up and say that I'm going to provide care at this level, then that is the facility that you need to put in place. That is the experience that the patient needs to get, right? So it's that finding your space on place on that spectrum, where what is it that you want to achieve in this one.
Right.
Look, there are people who have started private healthcare facilities and they charge as per the public tariff. And they are successful because their goal was such.
Yes.
Like, what does it take to deliver what you aspire to deliver as a caregiver, care provider,
Yes.
or facilitator for other care providers to be under your umbrella, under your banner, to do that thing for you or on your behalf or with you.
Yes.
And the second thing of that is, how do you project what is going to happen in 6 months, 1 year, 2 years, 3 years, and how prepared are you, and you always have to have a plan B,
Yes.
right?
If it doesn't work out.
Right. I
something
would
else.
even say that, well, no, look, there are certain ways of going about it. That stubbornness that I was talking
Right.
to you about.
Yes.
Right. So there is nothing like you failed in plan A or you failed in plan B. You got to have multiple ways of making the plan A work.
Right.
That is stubbornness, right? I
Yes.
mean, you have your goal, you have defined your mission, you know what it takes to accomplish that mission. You just need to work with the combinations of making it, make the magic. The
Right.
chemistry has to work one way or the other.
Yeah.
Yeah.
Right. Is it financially rewarding? Is it worth it? So, a doctor who's working in a public setting,
Right.
yeah, would you advise that doctor to start their own clinic?
See, again, like I said, what are you trying to achieve? If you're
Financial
going
aspect.
to financially, right? So, if you're going to give a solution that 10 other people are providing,
Yes.
what is your USP? Right? So, what have you identified as your USP, and why should me as a consumer come to your clinic and not to somebody else's clinic?
Right.
Right?
Yeah.
So, that is going to determine whether you are going to be successful in your practice or not. And that is true for every medical professional. Even in public settings, why should that one particular patient wait on your waiting list if you are not going to do something which is unique, which is special, which is going to create a solution or give a solution to that person's problem? It's just that one is in private setting where it is outside of the public sector. One is within that public sector, but the basic rules are the same. Why should one patient listen to you?
Right.
See, I mean, it's a very harsh way of putting it. At times you might call it, but I say that wearing that white coat is a privilege. It's a blessing. Just because you wear it doesn't give you any right that you can play God in people's life,
Yes.
right? And very many, see, at this point now, I graduated in 2006, so now it is close to 2 decades of practice. Like, if I include my residency and all of that thing, that is 2 decades of practice. We've seen that majority of the people in caregiving world either are, it's one or the other. Either people carry that demigod syndrome, or they have that imposter syndrome. Very few
Yes.
people
Are in the middle.
are in the middle, and that middle thing is like happiness.
Right.
You can't stay there. You come in and out of that every time. Now, if you're a perfectionist, you always second guess yourself. And at times people just get carried away by that and run into that demigod syndrome.
Yeah.
You can't be either of it.
So you're saying
Yeah.
the personality, your personality itself, plays a
Right.
big role into you starting your own practice.
Right.
Right.
Are you confident enough to say that I am going to deliver healthcare at this level and not let that thing fall, come what may?
Mm-hmm.
And then it comes at the cost of being nice to your colleagues. It comes at the cost of spending that much money.
Mm-hmm.
Sometimes, I mean, there have been times during COVID in my practice
Yes.
where I spent a lot more just to ascertain a certain standard of care. So if I have a high profile patient coming in my clinic
Yes.
and I need to deliver care,
Mm-hmm.
and the person needs to know whether we are safe, then I have to get my involved team to get RT-PCR, which comes at a cost, and the total treatment cost is less than that. But then if I am going to tell you that I promise you that we are going to be safe, then that's the cost that I'm going to pay. Now that is possible in a private setting because I am taking that decision.
Yes.
I am ready for that decision. I have thought about it. I have put my resources in place. In a public setting, there is somebody else doing that thing for you. There is somebody else making that thing available for you.
Mm-hmm.
Right? That's the difference. So,
Right.
in a public setting, you look up to somebody. In a private setting, you are that somebody.
Yes. Yes. Yes.
So that, are you ready to shoulder that responsibility? Are you ready to do all of that it takes? And then your caregiving part never goes.
Mm-hmm.
The medical experience part never goes.
Yes.
So if you're ready for all of that, then yes, I mean, financial rewards will come.
Yes.
But you need to ascertain all these things before talking about financial rewards.
Right.
Yeah.
Thank you so much for that.
Yeah.
I mean, a lot of doctors, they might be good doctors, good at practice, but we are missing the entrepreneurship side of us, or we're even scared to go into that field and actually explore that field. So I love that you touched on that. That is still, you're still a doctor at the end of the day, and you
Right.
still need to give that the best medical experience to your patients.
Very true. Yeah. I mean, that is the essence of it.
Mm-hmm.
Everything else will come and go, but that needs to be the constant fact. Yeah.
Yes. So now that we're nearing the end of the episode,
Right.
we'll have one of our listeners. They wanted to ask you a question or advice regarding this residency, regarding this whole pathway. So we'll listen to this audio and maybe you can answer
Sure.
to this.
Sure.
Did you have to do both First, questions maybe. Firstly, the path to training in Rwanda. If you trained in Rwanda, did you have to do both medical and dental degrees before going into education? So, what that path looks like, and also what the scope of his work does, because in different countries, surgeons do different things. Maxillofacial surgeons do different things. So there's everything from like trauma to cancer treatment to facial feminization surgery, which I don't think is happening in Rwanda. But yeah, I think just like a scope of what he does, what he specializes in, what he enjoys in maxillofacial surgery. I guess also there's always the question of what doesn't he like about maxillofacial surgery? Would you recommend someone coming into it? And yeah, and also if someone wanted to get into it, what does he suggest? Does he suggest shadowing? Does he suggest like certain programs? That kind of thing. I think like the questions I have are more like, if I wanted to do it, then who would I speak to and what tips would they give me? That kind of thing.
Okay. Interesting. Lots of questions there.
By the way,
So-
this is a dentistry student
Uh-huh.
that was curious to know about that pathway.
Right. Right. Okay. So I think a bit of it we discussed.
Yeah,
The
most of it with.
the part of it in Rwanda we have a program which is a 5-year program, which is open for dental graduates to apply for through the University of Rwanda. Um, Scope of practice is basically you start with oral surgery, that is intraoral procedures, outpatient oral surgery, and as far as craniofacial surgery, that is in a part of a team with neurosurgeons and all of that. There would be oral cancer and oral cancer management, reconstruction, which will be with microvascular reconstructive surgeon. So the entire spectrum, we practice the whole spectrum in Rwanda. We don't have a dedicated craniomaxillofacial unit as yet, but that is where we are heading. Eventually, that will fall in place.
But at the moment, a maxillofacial surgeon can do.
We do like with our neurosurgery colleagues, we do joint surgeries. With
Right.
our ophthalmology colleagues, we do joint surgeries. With our ENT colleagues, we do joint surgery. Pretty much now the norm for cancer management is that we do reconstructive surgery with the microvascular reconstruction, like you
Yes.
know that's gold standard across the world, and we are doing that thing in Rwanda.
Right.
So it's all happening. Who to talk to? Moi. So just
Okay,
kidding.
you'll
Yeah.
know the plug.
just kidding. No, but since I'm the program director, I can give you all the information. There's the dean of dentistry at the University of Rwanda.
Okay.
Any of the faculty that we have on our program at the Rwanda Military Hospital, at Siashuka, I mean, we are all here for whatever information that you might want. In terms of how to get on with it, right? It's one thing is like, look, grass is always green on the other side is one way of looking at it, and grass is always green when it is watered well,
Okay.
right?
Yes.
Okay, so if you are interested in it, apply for a voluntary position, see if you can keep up with that thing. I've had plenty students who are like excited about maxillofacial surgery because it's like there's a degree of wow factor with surgery, right? And it in general medicine, because that impact is massive,
Right.
right? But then when you're in it, you suddenly realize that no, maybe this is not it. So I've had close to 10 odd interns who started their internship saying that this is our dream, and at the point of exit interview, they're like, nah, maybe not, because I'm not ready for it. Maybe I'll think about it in few years, into my professional practice. So give yourself that chance.
Right.
That I would say is true for every medical specialty, right? I would pretty much recommend any medical or dental graduate, young intern, doctor, give yourself that chance, give it a go, get your hands dirty with it, and ask yourself that question: can I do this thing for the rest of my life? And if the answer is yes, then yes, you've matched it in your mind,
Right.
and then you start working your way towards it. Right. So that's the best advice that I can give.
Right. Another pretty interesting question he asked: what do you like and not like about the specialty itself?
Oh God. What do I like and not like? What do I like is that I don't know whether it is unique to my practice or my specialization as such, but you can't hide your surgery, good or bad. Whatever I do on a patient is my signature on a patient. So
Right.
then it's like I have to constantly kind of one up myself. So
Have to be
that's
perfect with
well,
every surgery almost.
I mean, what is perfect, right? I mean, it's a relative thing. Whatever is the perfect solution for that given situation.
Yes. Yes.
But that's a challenging bit. I love that challenge. I love that challenge because very rarely would I say that this is my this is my best surgery. I don't think I have done my best surgery, because next one is going to be better than the last one, is how I was trained.
Yeah.
That you're only as good as your last best result. So, that is
Keeps going.
that is a continuous process. So,
Right.
what I don't like about this profession as such, it's like it's rare. I don't know if I don't like anything about this profession. I really can't point my finger and say that I don't like this,
Yes.
because everything is so fascinating and there is so much to do there, that I would still say that I'm still a student at it. So
Yeah.
I can't answer that question saying that I don't like that.
Yes. Yes.
But whatever I have been doing so far, I absolutely have loved that thing. And yeah, I mean, there is more that I can do, and I would say that there's nothing that I don't like.
Very
Yeah.
exciting.
Yeah.
It's good that you do something that you love every day.
Yeah.
You wake up every day. You want to go, have an impact on the community, on your patients, and it's showing. And that brings us to the end of the podcast. This was a very, very interesting and
Thank you.
inspiring conversation.
Very much so. Thank you.
I'm very honored to have you on the podcast, and I hope my audience, the listeners, they can also learn as much as I learned from this conversation. Thank you so much for
Thanks a
being
lot.
here.
Thank you very much.
Yeah.
Thank you. It's been a real pleasurable experience. It's really